If you've walked into any pharmacy lately, you've probably seen the supplement aisle looking like a candy store for grown-ups. Shiny bottles promising everything from better sleep to perfect memory. And yes, even a healthier prostate. In fact, research shows that once we hit our 60s, many of us are taking not just one but 4 or more different supplements a day. Some of us practically rattle when we walk. But here's the real question. Do any of these supplements actually help with prostate health? Or are we just giving our wallets a workout? I'm Dr. James Carter, your bone, muscle, and circulation specialist, and today I'm stepping a little outside my lane. But for a good reason. The prostate plays a big role in a man's comfort, confidence, and, let's be honest, his quality of life. And when it starts to grow, a condition called benign prostatic hyperplasia, or BPH, you might notice some frustrating changes, a weaker stream, more bathroom trips at night, or that annoying stop-and-start flow that makes you wonder if you'll ever be done. By the age of 80, about 80% of men have prostate enlargement. That means if you're lucky enough to have a few old friends left, chances are most of you are in the same boat. The problem is that boat sometimes feels like it's leaking, especially at 3 a.m. when you're up for the third time. So, wouldn't it be great if there were natural supplements that could help, without surgery, without prescriptions, and without the side effects? Today, we'll look at the most talked about supplements for prostate health, break down what science actually says about them, and most importantly, see if they're worth your time and money. I'll also share which ones might be all hype, and which ones could actually make a difference. And listen, if you're over 60 and you think, oh, this doesn't affect me yet, you're exactly who needs to hear this. One day you wake up and realize your bathroom visits run your life, not you. By then, you wish you had learned what to do years earlier. Don't make that mistake. Subscribe right now, because missing this kind of information could mean years of discomfort that you could have prevented. Your future self will thank you, and so will your sleep. Now, before we start naming names and pointing fingers at the supplement aisle, let's talk about how these things are supposed to work. Most prostate supplements come from plants. We call them phytotherapeutic products. Sounds fancy, right? But here's the thing. Plants are like people. No two are exactly the same. You can grow 2 tomato plants in the same garden, water them the same way, and one will give you beautiful, ripe fruit, while the other looks like it's been through a windstorm. That same variability happens with plant-based supplements. Even if you buy the same product from the same brand, the actual active ingredient might be higher one month, lower the next, and sometimes missing altogether. In fact, one big study looked at 27 different saw palmetto products, one of the most popular prostate supplements in the world. Guess what they found? Some had the right amount of active ingredient. Some had barely half him and a few had none. That's right, people were swallowing empty promises in a capsule. And it's not just about what's in the bottle, it's about how your body reacts to it. Supplements often work in a few main ways. They can reduce inflammation in the prostate. They can slow down certain hormones like DHT that make the prostate grow, or they can interfere with the growth factors that tell those prostate cells, hey, let's multiply. Now that all sounds great on paper. The challenge is, for a supplement to really work, you need a consistent dose of the active ingredient. Your body needs to absorb it well, and you have to take it long enough to see a difference. And when I say long enough, I don't mean a week. We're talking months. This isn't a light switch, and it's more like slowly turning a cruise ship around. But here's the part that gets tricky. Even if the science makes sense, the results aren't always there in real life. And that's why we're going to look at the most heavily studied prostate supplement of them all, saw palmetto, and see if it's the miracle it's marketed to be, or just another expensive habit. All right, let's talk about the celebrity of the prostate supplement world, saw palmetto. This stuff has been sold for decades, promising to shrink your prostate, improve your stream, and basically give your bladder a second youth. If prostate supplements were high school, saw palmetto would be the quarterback dating the prom queen. It comes from the berries of a dwarf palm tree. The theory: it reduces inflammation, slows down that pesky DHT hormone that makes the prostate grow, and even blocks DHT from attaching to the prostate cells in the first place. On paper, that's like hitting the problem from 3 angles. In the 1990s, saw palmetto was huge in Europe and the US, and for good reason. Early studies looked great. Doctors were excited, men were hopeful, and supplement companies were, well, probably already planning their beach vacations. One of the biggest early studies was published in the New England Journal of Medicine. That's the Harvard of medical journals. They ran a gold standard trial, double-blind, randomized, meaning nobody knew who was getting the real stuff and who was getting a sugar pill. Men took 160 milligrams twice a day for a whole year. They measured everything: symptoms, urine flow speed, how much urine was left in the bladder, even quality of life. And after all that, no real difference between saw palmetto and the placebo. None. Both groups improved about the same. Which means, and this is the hard truth, a lot of the improvement might have been from the placebo effect. That's when your brain believes something's helping, so you feel better, even if there's no active ingredient doing the work. Then in 2011 they went even bigger, over 300 men, across 11 centers in North America. They started with the standard dose, then doubled it, then tripled it over 72 weeks. Still, nothing. No measurable difference in symptoms or urine flow. Now, here's where it gets interesting. When all the data from multiple studies was combined in a massive Cochrane review, they looked at over 2,000 men. The verdict? Saw palmetto didn't work better than placebo for prostate symptoms or urine flow. So should you take it? Well, here's my take. If a patient tells me they want to try it, I don't say no. It's generally safe, with few side effects. But I'm honest, the research doesn't show a clear benefit. For some men, it's a wallet drain. For others, maybe they get that placebo boost, which still feels like an improvement. And hey, if your quality of life gets better, and it's not hurting you, now that's a win in my book. But remember, I'm here to give you the truth, not sell you a bottle. If you're looking for something that's truly proven, you might want to hear about our next supplement, which has shown some short-term benefits, but also some big question marks. Let's get to the part you've been waiting for. Are there supplements that can actually shrink an enlarged prostate? The short answer? Maybe. But the details matter. Saw palmetto is the most famous. It's been used for decades to support urinary health in men. Some studies show it can reduce symptoms like frequent nighttime trips to the bathroom. But here's the kicker. While it may help with symptoms, research is mixed on whether it actually makes the prostate smaller. Then there's beta-sitosterol, a plant compound found in certain seeds and nuts. It's been shown to improve urine flow, but again, it's treating the plumbing issues, not necessarily shrinking the gland itself. Pygum africanum, African plum tree bark extract, is another supplement with promising symptom relief data, but not strong proof of shrinking. And finally, pumpkin seed oil. It's nutrient-rich, may improve bladder function, but you guessed it, it won't melt your prostate like ice. The truth is this: if a supplement works for you, that's great, but most don't directly shrink the prostate the way prescription medications or procedures can. They can make life easier, but they're not a magic eraser. Now here's where I have to set the record straight once and for all. If you see a supplement claiming it will shrink your prostate back to the size of a teenager's in just 2 weeks, I have one word for you: no. As a urologist, I can tell you this: the size of the prostate can change, but not in the miraculous overnight way these marketing ads want you to believe. In real medicine, shrinking an enlarged prostate significantly is usually achieved through prescription medication or certain procedures, not just supplements. That said, the right supplements can support prostate health, reduce inflammation, and help relieve symptoms like frequent urination, weak stream, or that frustrating nighttime bathroom run. But they won't replace proper medical treatment if your enlargement is severe. Here's the truth: supplements are helpers, not miracle workers. Think of them like the good neighbor who waters your plants while you're away. They can help keep things healthy, but they can't rebuild the whole house if it's already collapsing. And yet, I see far too many men delay real treatment, relying solely on miracle pills, and by the time they come to my clinic, their bladder is already struggling, and surgery becomes the only option. That's why you need to be informed, so you're not just buying hope in a bottle, but actually protecting your health. All right, gentlemen, time for a straight side-by-side look at reality. When it comes to an enlarged prostate, here's how supplements and prescription medications really compare. 1. How they work. Supplements. Most work by reducing inflammation, supporting hormone balance, or improving urinary flow. Think of them as slow, steady helpers for long-term health. Medications, drugs like alpha blockers, tamsulosin, relax the muscles around the prostate, and 5-alpha reductase inhibitors, finasteride, actually shrink the prostate over time by affecting hormone conversion. These have a direct, measurable medical effect. 2. Speed of results. Supplements usually take weeks to months before you notice symptom improvement. Medications often start easing symptoms within days to weeks, though shrinking the prostate itself can still take months. 3. Side effects. Supplements generally mild if taken as directed, but can interact with other meds or cause stomach upset. Medications can cause dizziness, lowered libido, or even retrograde ejaculation in some men. 4. Effect on prostate size. Supplements can support a healthy prostate and possibly prevent further enlargement, but rarely reverse size significantly. Medications, clinically proven to reduce size in many cases, though the change is gradual. Bottom line, if your symptoms are mild, supplements plus lifestyle changes may be enough to keep things in check. But if you're getting up 4 times a night or struggling to empty your bladder, it's time for a doctor's evaluation and possibly prescription treatment. And remember, sometimes the best approach is both, using targeted supplements alongside medical treatment for the most complete protection. The honest verdict: can supplements truly shrink your prostate? Let's get right to it, gentlemen. The truth is, most supplements cannot physically shrink an enlarged prostate in the way surgery or prescription medication can. But that doesn't mean they're useless. What the evidence shows is that certain supplements, like saw palmetto, beta-sitosterol, pygium, ryegrass pollen extract, and zinc, can reduce inflammation, improve urine flow, lessen nighttime bathroom trips, slow further enlargement in some men. In other words, supplements may support prostate health and make symptoms far more manageable. But if your prostate is already severely enlarged, you may still need medical treatment. The problem is, too many men fall for the miracle cure hype and waste hundreds of dollars on overpriced pills with no clear results. And meanwhile, the real issue, whether that's benign prostatic hyperplasia, BPH, or something more serious, is left untreated. Supplements should never replace proper medical evaluation. A growing prostate could be harmless, or it could be an early warning sign of prostate cancer. Don't gamble with your life for the sake of avoiding a doctor's visit. So the best path forward? Use supplements wisely, alongside a healthy diet, exercise, and regular prostate checkups. That's how you protect yourself for the long run. Gentlemen, I'm going to be brutally honest here, because too many men ignore these warning signs until it's too late. If you experience any of the following, supplements alone will not save you. You need to get evaluated by a doctor right away. Blood in your urine or semen, even if it's just a tiny drop. Severe pain in your lower back, hips, or thighs. Sudden inability to urinate. This can become an emergency within hours. Unexplained weight loss, especially if your appetite is also gone. Loss of bladder or bowel control. This may mean serious nerve involvement. Night sweats, fever, or chills. Possible signs of infection or cancer. These are not wait and see symptoms. They are urgent. Here's the reality. A supplement can calm inflammation, but it can't remove a tumor or treat an infection. And the longer you wait, the fewer options you have. So if your pride, stubbornness, or fear of doctors is stopping you from making an appointment, think about your family. Think about your spouse, your children, your grandchildren. They'd rather have you alive and well than hear you say, "I wish I'd gone sooner." So before you click Buy Now, ask yourself, has this product been reviewed in trusted medical journals? Does my urologist recommend it? Are they making promises that sound like magic? Your health is too important to gamble on false hope. Stick with proven supplements, lifestyle changes, and regular checkups, and you'll have a far better chance of protecting your prostate without risking your safety. Before you click away, I've seen men wait too long to act. 1 year they're just getting up twice a night. The next they're rushing to the ER, catheter in place, and wondering why they didn't take their prostate seriously sooner. If you're lucky enough to be hearing this while you still have choices, then please, don't waste it. Every week on this channel, we cut through the noise and give you the real science, the life-saving truth your buddies at the golf course aren't talking about. Hit subscribe now, because the next video you see from me might be the one that keeps you out of surgery and in control of your life.